Opioid Abuse as a Public Health Challenge, a group investigation by Christina Wilkerson, Chasmin Thompson, and me, Jennifer Furcher. The purpose of our project is to examine the recent crisis in the United States surrounding prescription opioid abuse. Our objective is to describe the challenges and identify the stakeholders involved in the opioid epidemic. We also will identify the advantages and disadvantages surrounding this public health challenge and identify what changes are needed. A very disturbing fact is that prescriptions for opiates have quadrupled since 1999, and only recently there is awareness of this problem. The abuse and addiction to opioids, including prescription pain relievers, heroin, and fentanyl, is a serious crisis that affects public health in addition to social and economic welfare. Four theories comprised together make up the self-care deficit theory by Dorothea Orem. She believed that each patient is the authority for their own health. As with many challenges, the nursing process can be used to effect change in many problems, including this one. Beginning with assessing the problem and building a plan for change, the nurse can then implement the changes and evaluate the progress thereafter. Nurses certainly play a role in effecting change. They serve as educators and caregivers to help the patient establish communication and set up goals related to their pain. With sudden discontinuation of opioids, withdrawal symptoms can occur. They can be very severe, ranging from cold sweats, headaches, muscle aches, diarrhea, insomnia, delirium, and even violent behavior. Therefore, addicts will go to many lengths to prevent these symptoms. In this image that went viral on the internet over recent years, you can see the parents of this young child going to whatever lengths they needed to support their addiction of opiates. Many states are considering stricter regulations on opioids. Recently, South Dakota published a white paper on opioid abuse called Opioid Analgesics for Chronic Non-Cancer Pain, which gives evidence-based guidelines to providers related to pain management and the abuse of opiates. About 80% of abusers were introduced to opiates through a prescription. Among the individuals, 48 to 92% who have died from opioid overdoses had a prescription. There are many reasons why tamper-resistant formulations will not curb the opioid epidemic. First, many of the formulations that include naloxone, which counteract the effects of opioids if administered intravenously, which is a strategy that targets abusers who use injections. Naloxone has limited oral bioavailability. These formulations have little effect on the psychoactive properties when the medication is chewed. Second, some of the formulations that have physical properties to stop crushing may be used without crushing or by some other means to defeat the tamper-resistant mechanism. Third, tamper-resistant formulations are more expensive than the generic brand of opioids, and they may not be covered by private insurance or public formularies. The prescription of conventional opioids without tamper-resistant properties will likely continue. And lastly, the overprescribing of tamper-resistant formulations may happen, especially if the prescriber believes that such formulations produce prescriber liability or confer safety benefits for their patients. Regulations requiring tamper resistance represent an expensive, technical approach that is influenced by pharmaceutical interests and cannot solve the opioid crisis. An evidence-based, multifaceted strategy is needed, one that has real potential to curb the opioid-related harm at a population level. Tamper-resistant formulations are a gimmick, and health professionals should not be fooled by them. For a new drug to receive a label for abuse deterrent from the FDA, the agency specifically requires that new products be studied for abuse potential relative to a previously approved version of the product as a positive control. Currently, the availability of ADFs can help reduce the chance of the following. 1. Patients progressing to abuse by non-oral routes. 2. Individuals with established substance abuse disorders developing new complications related to their disorders. 3. Misuse due to unknown risks associated with product manipulation, which can result in overdose-related morbidity and mortality. ADFs can also reduce the likelihood of civil and criminal liability that physicians and pharmacists can face with the result of overdose-related deaths caused by the patient's abuse. Physicians seem more willing to prescribe, and pharmacies are more willing to dispense ADFs to the patient with real needs, which can reduce the barriers to access for patients with legitimate needs. There is a significant increase in the cost of ADFs. While some argue that the benefit outweighs the cost, the fact is that those who seek opioids are not deterred by these formularies. They just find another way to support their habit. With the use of prescription drug monitoring programs, there are some limitations. However, the prescription drug monitoring programs do not track the prescriber's practice area or the condition a prescription was intended to treat. The prescription drug monitoring program has a few more limitations. For instance, the study uses number of prescription fills as a proxy for ingestion of the prescribed drug and assumes that medications are actually being taken by the person whom they were prescribed to. Change is needed. The population's perception on pain relief and opiates must be changed by stringent education. Federal and state governments must work with the healthcare profession to help make law and policy changes. This is a national crisis that needs immediate attention.